The patient-centered care in my daily practice will present on respecting patients' preferences and involving them and their families into the care. Give them enough support and respecting their autonomies. Like when dealing with non-English speakers and confused patients, I like to ask their families about their ADLs to make an individualized care plan which is more suitable for them. When patients and their families are anxious, I would like to explain everything of what I'm doing and give them plans of what is going to happen next. If I made a medication error, do not panic. Make a deep breath. Firstly is to identify my patient's safety. I will notify the patient's doctors and also that my team leaders knows. Then identifying the potential side effects that could happen to make sure I'm not panic if I see those symptoms. After stable my patients, I will do a risk management report and then notify their families of what happened and make apologize for them. As a student nurse, I had a near-miss medication error once. I did the wrong dose of metoprolol for my patients. It's supposed to be cut in half, but I forgot to do because my body nurse was in a rush. So what I'm learned from here is you really need to be very concentrate on managing medications. Do not be interrupted, and I would like to speak the medication's name and the dosage out on the chat and do a double check it on the package. I will identify my patients and their allergies before I deliver the medication. As a student nurse, I rarely have the situation of high acuity of patients loading in my placement, but working in an aged care facility as an AAN, I do feel overwhelmed sometimes when we are short of staff or I need to do a double shift. I can easily recognize when I'm under pressure or stress. The pressure will enlarge my negative emotion and affect my quality of care. The way I'm handling is to stop of what I'm doing right now, take a deep breath and ask for a break. Think about the happy moments come from patients and think about why I want to be a nurse. And then I will come back to my work, reorganize my task priorities, and then if all of those things doesn't work, I will seek help from my colleagues or my team leaders. Nurse is never personal tasks. We collaborate with each others. So if this pressure is a long time one, in order to avoid burnout happening, I would like to ask for short leave. So my understanding of safety and quality standards, work health and safety is we have the responsibility to manage risk to the health and the safety of everyone in the workplace, not just the organization its own, especially when we provide care to our patients. We need to make sure do not do any harms to them and keep them in a safe, like keeping the environment safe if we have the COVID positive cases, safe way to work, always following the protocols, make sure do not do anything that could hurt others. Attending all the training and the learning courses to have continuous education and knowledge update. Always carefully listen to my patients and their families' issues and concerns. Be cultural awareness and respecting their beliefs and their preferences. Be thoughtfulness towards to others. Give their support to my patients and colleagues who are in the difficulties.